Post-acute withdrawal syndrome, or Paws as it's often abbreviated, is the name given to a series of symptoms that can often present themselves to people after they detox from drugs and alcohol. Once their body goes through the initial shock of getting clean, a new culprit creeps into the mind of people who are trying to get better. Often, it can be hard to see, as the symptoms are more psychological than the acute withdrawal symptoms like cramps or nausea that happen during detox. This is a pain that can't be measured, but it can be just as big a risk to relapse. With that in mind, we reached out to friends and experts to help us understand what Paws is and how we can manage it.
When we see patients for inpatient rehabilitation services, because they are in active addiction and have a substance use disorder, they go through the detox phase of treatment and really what is the acute phase of treatment. I like to say that rehab is an acute response to a chronic disease. So when they finish their rehabilitation treatment inpatient and then leave the rehab facility, they're now in the post-acute phase. This is where things get serious. This is where recovery really starts, and this is where the work really starts.
Actually, it's the brain in and of itself. The damage that's been done to it is trying to repair itself, and it's post-acute. That means it's coming after the time you went through actual detox. So this is going to last anywhere from, could last to 6 months, it could last up to 24 months. Because the brain doesn't release dopamine the way a normal person's does. That's where our issue is. It's right in the midbrain. So somebody feels good about something and you had something that made you feel good, it doesn't necessarily have the same effect on me. So that's where my deficiency is, and that's where it lies. So we know how to make our brain get those excitotoxins and to release that dopamine, and that's where we go back to what we do, because any type of using drugs, alcohol, whatever it is, gives you that feeling, and so it releases that those endorphin rush from the brain. So it gives you that sense of well-being. I feel good, I can do anything kind of thing. And when you're in inpatient treatment, you're in a protected environment. They talk about a pink cloud. When you come out of there, it's kind of like, oh, everything's all great and nothing's going to bother me. I'm 10 foot tall and bulletproof. And then when you get home, then those issues that have been kind of cultivated prior to my entrance into treatment, they're right in my face again. And so that's when things start to change. And that's when you start finding you really are sensitive to post-acute withdrawal at that time, because you're sensitive to stress, you can't sleep, you have emotional upheavals, it's up or down, or you don't feel at all.
The brain is really trying to reacclimate to a normal state of where it would have been prior to the drug or alcohol use. All of their reasoning functions are off kilter. They're just not thinking clearly. And they have these big emotional upswings and downswings. And when a person's having all this emotion driving them, they're making bad decisions.
So there you are, feeling healthier than ever. You've made the life-saving decision to get clean. You went through the pains of detox, and you think that you're on the back side of this difficult chapter in your life. Then it hits. Confusion, memory loss, you're feeling stressed out, can't sleep, you just can't seem to think clearly. You say to yourself, what the hell? I thought I was past this. In situations like that, you may very well be suffering from post-acute withdrawal syndrome.
Increased stress response, irritability, inability to control our emotions. You know, we swing back and forth. A lot of times you can be diagnosed with bipolar or manic depression in early recovery. Anxiety and depression are two big ones. Inability to think clearly or focus. Difficulty with completing tasks that used to be real easy to you. Memory problems, memory loss, inability to store new memories. Sleeping problems, whether you're sleeping too much or not getting enough sleep. So all of this different stuff is a result of the chemical imbalance in the brain that naturally occurs when you remove the substance from the person's life. So when you take away the drinking and the booze, when you take away the drugs that are stimulating this excessive amount of dopamine and serotonin, the pendulum swing of that is the brain has now got heightened levels of cortisol and norepinephrine and adrenaline, which causes anything, like you could spill a glass of milk and lose your mind and like start throwing things at the wall because it's so stressful.
We've all been there. That day when the sun isn't shining and the birds don't sing. Feelings of dread and despair start to sink in. But it's important in these times of struggle that we anchor to what we know is true. This is only a momentary feeling, and these thoughts will pass. You have to give your brain time to heal both mentally and physically. During that time, you have to learn healthy ways to manage your feelings instead of turning back to the substances that want to control you. It's hard, I know, and it can hurt, but it's so worth it. Let's look at some ways that we can weather this storm.
So somebody will leave rehabilitation, they will feel great, they will feel like Superman, they'll feel incredible, their life will feel like it's manageable again. But they leave the safety and security of a rehab facility, they go back home and they have all the same stressors and pressures. They've got their spouse, their parents, their siblings, their work, their neighbors, the people that they were using with, their friends, their dealers, everything they encountered in day-to-day life before is still there now. And so when they have to encounter these again, immediately the brain's solution is just use, you'll feel better. And so it takes, at that point, it takes either extreme willpower or it takes continued treatment and staying engaged in a comprehensive recovery program. This is what the 12-step meetings are for, right? And you hear people going to 12-step meetings. Find a meeting, find a sponsor, find a long-term case management program, find a coach, find a mentor. Get people and places in your life that are going to continually be there, top of mind, keeping your recovery top of mind at every minute, so that when you have that trigger, when you have that craving, when you have that crisis, you have something to turn to other than your drug of choice.
So if we can help them discover for themselves who their friends and their tribe is, so to speak, then we'll be a lot more effective going forward. Because those safe people are the people that we want to encourage them to continue with. And the people who have not been safe, we want to counsel them to set healthier, stronger boundaries with them for themselves.
I think that probably the biggest thing that I wish I would have known on day one of sobriety is that the best I've got is to be like a mistake-making human being. It's the best I'm capable of, and that's okay. I mean, as long as I keep trying, I'm okay with that. Because there was a lot of times when I wouldn't perform up to my idea of perfection, and then I feel like a failure, you know. And this measuring system, or this ranking system that I had in my mind of who's doing well and who's not, was the cause of a whole lot of inner struggle, a whole lot of self-esteem issues, and a whole lot of mistakes, you know, trying to do things in my life that would make me feel successful that ultimately robbed me of my time and energy and emotional well-being. So to allow myself to just be a person, to just be another human being, would probably been the biggest thing that I would have done. Instead of trying to go from drug addict with all these self-esteem issues to, you know, Mr. Super Successful Entrepreneur that's saving the world or something like that. You know, it's like this outlandish idea of what perfection looks like.
The first thing you should know if you've made the decision to live in sobriety is that your friends and loved ones are proud of you. You knew this was going to be tough, but you're still walking that path. Some days that road is going to feel smooth and have a wonderful view. Other days it may be steep and rocky with no blue skies in sight. But each step you take leads you further away from pain, suffering, and even death. Some have walked before you, some may walk beside, and undoubtedly some will follow your example. But to get where you're going, you have to start. Remember, recovery is a journey, and that journey begins with the first step.